rise of the smart hospital and an ageing population, the demand for effective communication networks across Europe's medical campuses has really been increasing. Traditionally, hospital networks use switches, but these days, certainly in France and Spain and beyond, the go-to option is optical. Some leading institutions are already studying how to make smart hospitals smarter still, to develop even faster. And luckily, someone who knows all about that is Javier.
Hi, I'm Javier Herrero. I'm a strategic manager of Smart Health TV Solutions, and also I'm the Vice President of the Digital Healthcare Commission at AMETIC Association in Spain.
Great. Well, Javier, tell us then, what is the state of smart hospitals in Spain at the moment?
The network infrastructure in Spain and the hospital is, I think, is very strong, but has been deployed with technology of 10 years or 15 years ago. And this means that, we need to, in order to face this new challenge of the digital transformation and artificial intelligence, data, I think the idea is to improve this network. How? Well, we can use this new technology based on the passive optical networks.
Well, talking about that, so POL and F5G are both optical fiber network architectures. What are the sort of specific applications of those in the smart hospital?
Well, at this moment, all the huge data transfer, especially for medical image, all these type of things, and also the video conference, video transmission between operation centers, or even the idea to connect patient at home with the doctor at hospitals. Because one of the challenges in the Spanish and also European hospital in this moment is in order to translate patients from the hospital to the home. The idea is to try to optimize the use of the hospital rooms. And in order to do this, we need something that we can communicate without bottleneck in order to provide services from the hospital directly to the home. In this case, the multi-conference, for instance, is impossible at this moment to deploy 4K high-definition multi-conference system using the infrastructure that we have now in the Spanish hospitals. One problem that we have when we digitalize the healthcare is that people expected that will be available 24 hours per day. So in this case, it's reliable. Now we have a lot of different networks with different technologies. The idea to optimize and deploy only fiber plus Wi-Fi or something in a very, very reliable atmosphere, in this case environment, because at this moment, imagine if you have been trying to use your 4G or Wi-Fi mobile phone at a hospital, there is a lot of problems, a lot of interference, a lot of different devices trying to communicate with its own protocol. Well, one of the possibilities of these new technologies based on optical networks is to standardize all this type of communication and reduce these problems, especially this electromagnetic contamination that we have in our hospital buildings.
Well, talking about problems, when you promote any new technology, there are challenges to that in terms of financial challenges, logistical challenges, operational challenges. How do you overcome that? How do you hope those challenges get overcome in implementing all optical networks?
Well, I think that at this moment will be very easy because the return of investment is easy to calculate. So, because there is a lot of information, the technologies, we can consider the passive optic network is a new application of an old technology. Cable companies have been using the passive optical network for years, but now it's a new use with an improved technology in order to give this technology a new life. Okay, and I think it's more easy for the hospital managers to identify. They know what are his problems now, and it's very easy to identify how you can remove these problems using the new technology. To calculate this return of investment I think is very, very easy.
So are you very confident? You certainly sound quite confident that actually this isn't that much of a challenge. It's going to happen. We are going to have all optical networks across these hospitals?
Imagine we have been problems in the past with trials, for instance, providing multi-conference services from doctors to patients at home. And sometimes we need to, in this pilot or these trials, we need to ask doctors to go out of the hospital in order to do the video call, because it was impossible to do this call inside the hospital, because the Wi-Fi of the hospital and the 4G footprint in the hospital was very, very bad. And we need to ask the doctor to go out. Well, we think that with passive optical networks, we can solve this problem, because at the patient point of view, at home, for instance, we have in the last mile, we have solved. We have fiber to the home, more or less, or at least we have 100 megabit per second at patient home. But now the bottleneck is in the hospital, you know. And we have been talking about 4G, etc. Yeah, but for instance, private 4G is better deployed if you have a passive optical network connected to the campus, you know. And I think this type of things, I think that can improve the bandwidth available. But in this case, it's not per service, it's per person, because every doctor has a lot of requirement in the future if they want to use this advanced communication. And of course, the patients, they are not, how you say, when you do a video conference at work, you expect to have problems. The patients don't know that this problem can happen, you know. Well, and I think we need the most reliable services that we can offer.
And it sounds like as a result you'll have a win for hospital administrators, the medical staff and the patients themselves, which is a win-win-win across the board.
Yes, especially now that the healthcare professional, I think that they now have more information on what they can ask, or how we can use all these new technologies. They are in digital transformation, you know. The new generation of healthcare professionals, they use this video conference, or they use these services. They are not afraid about use artificial intelligence, but they can wait 5 hours to translate files from one system to another, you know. Well, this type of things, I consider that now the professionals are more prepared to adopt and especially to request a specification or to participate in these new deployments in order to be totally sure that this is not a technology trend. Right? We are not removing or upgrading the network just to spend money or just because it's the trend, the new technology trend. Well, I think in this case, passive optic network is a technology that will be really useful in the future.
Javier, thank you very much.
Thank you very much.